Here we will describe midface injection with cannula. We will mark out our port site, which is roughly at the junction of the zygomatic arch and body. Here is the orbital retaining ligament, and then we mark out the pathway of the zygomatico-cutaneous ligaments, creating the boundaries for the pre-zygomatic space. Then we mark out the zygomatic arch for appropriate orientation. Here we see on our port site the location of our cannula insertion site. We'll use a BD syringe with local anesthesia to place a small wheel of local anesthetic with epinephrine. We can now see the blanching of our port site. Using the needle, we will vector inferior medial to create a tract to pass the cannula through. Remember, the key component here is utilizing both injection hands. So here I'm stabilizing my injection hand along the zygomatic arch, and I'm pinching and pulling until I pop through the SMAS. That pop is often an audible and palpable sensation of getting below the SMAS into the pre-zygomatic space. Using your contralateral hand, you can feel the ligaments. There we tilted the cannula to confirm our depth. And the idea here is to gently bounce off the ligaments to make sure that we can confirm our boundaries. You will feel the periosteum as you glide along it. This confirms that you're in the deep plane. You can always pinch and pull the tissues to confirm your cannula is deep to the orbicularis muscle. Here we will perform retrograde radial injections from a superior lateral vantage point to allow us to look at the cheek radius and expansion. In doing so, we will be able to, again, palpate in between the ligaments. Here we're bouncing off the ligament to demonstrate it to you and tilting our syringe to confirm our depth. The contralateral hand and injection is very important here. It can either provide countertraction as seen here, or it can sit on the undersurface of the ligament so you can sandwich the ligament with the tip of your cannula. Again, placing volume here to create expansion in the pre-zygomatic space. The volume will depend on the patient and their necessities as in regards to how much. Again here, very gentle injection through the port site in a retrograde fashion. The final injection will be a bolus on the main zygomatic retaining ligament, and then oftentimes we will finish with needle bolus injections along the zygomatic arch to complete lateral cheek contour. Here you can see the injected side on the right and the non-injected side on the left. Notice the left is deflated with visualization of the nasojugal groove.